Hi, my name is Justin Shaper. I'm the Chief Technology Officer with Empiric Health. We're here to give a quick overview of a project involving total cost of care analysis in surgery. In our circumstances, we wanted to identify how claims can be used to measure the total episode cost of care associated with the surgical procedure. Also with me today is Dr. Megan Baltima, Chief Data Scientist at Empiric Health. Next slide. As an overview of our case study, our objective was to evaluate the variance in the total cost of care for surgical episodes across a large healthcare system consisting of 20+ facilities and dozens of surgeons. Our base method utilized groupings of surgical cases into clinically similar procedures called cohorts. This was done in order to provide the appropriate clinical context in making the variance analysis. Our approach included bringing in both clinical and claims-based data sets. This approach allowed us to group these in a way that's more meaningful and more relevant than just based on billing and procedure codes alone, which is often the traditional approach to this type of analytics. In addition, we applied natural language processing to abstract further concepts out of the surgical operative note to improve the granularity of the results. Next slide. Our data consisted of multiple years of surgical data from a large healthcare system combined with a large payer with claims data that covered more than 900,000 lives in the state of Utah. This together provides a longitudinal picture of the care provided through the surgical procedure, both on a pre-admission and post-discharge basis. Fundamental problem we ran into as we began this process, though, is that claims data is complex. It's difficult to identify the claims that are specifically relevant to the surgical procedure, and as a result, it's often challenged to pull out the relevant information from the noise of the background. Next slide. Again.
So what we wanted to do was to be able to develop a machine learning approach to identify and remove unrelated claims from our data set. In order to do this, we took in information about the primary surgery and about the diagnosis of every follow-up claim that occurred for that patient. We trained a light gradient boosting model that performed its classification on elastic net predictions. So this is a stacked machine learning model. We were able to feed in a large amount of training data that was curated by our clinicians. And then we performed a feedback loop to be able to improve the model's predictions using our clinical insights. So what we're showing here is an example of a claim where an example of an encounter where all of the claims included claims that were unassociated with the primary surgery, a total knee arthroplasty. Once this data was evaluated by our predictive models, we were able to identify and remove the unrelated claims. Overall, when we look at the impact of this analysis, we can see the reduction in noise across multiple facilities. So what we're looking at here is a data point for every encounter and every episode of care for a patient. These patients were undergoing a laparoscopic cholecystectomy. They were outpatient and they were adults. What we can see on the top figure is that when we're looking at the raw claims, there's a wide variation and noise associated with unrelated claims for those patients. After processing with our machine learning approach and removing unrelated claims, we see a reduction in that noise. This allows us to start our analysis for the total cost of care and be able to look at the true signal and variation for the patient care.
We hope you find this project of interest, and we look forward to talking with you at the virtual conference in September. Thank you for your time.